In this module, we will be reviewing the support coordinator's responsibilities in ensuring the health, safety, and well-being of the individuals that we serve. In providing services to all individuals that Spectrum CMC serves, the employee must be aware that the health and safety of the individual is the primary focus, while also respecting the rights of the individual. The rights and responsibilities document that we provide to families can be used as a guide. For individuals with intellectual and developmental disabilities, the support coordinators monitor services monthly and conduct face-to-face visits quarterly and as needed with the individual receiving services. For all visits, the employee should see the individual and conduct a health and safety evaluation to ensure that the individual is well cared for and to determine if additional services are needed. Of course, in a case of an emergency, the employee should contact 911 when needed. The employee's supervisor should be immediately notified and an unusual incident report, URI, required. Additionally, the main number for the DDD is shown here, 800-832-9173, and should be called immediately for cases of suspected abuse, neglect, or exploitation of an individual with an intellectual or developmental disability. It is a requirement that each person who has been determined eligible to receive services from the division must have an Individualized Service Plan, ISP, developed in iRecord according to the standards specified in the policy manual and through support, coordination, orientation, and other training opportunities. The plan will be developed by a planning team of appropriate persons to include, but not be limited to, the individual, the support coordinator, and the individual's parent or guardian as appropriate. This plan, developed based on assessed needs identified through the New Jersey Comprehensive Assessment Tool, or NJCAT, the Person-Centered Planning Tool, PCPT, and additional documents as needed, identifies the individual's outcomes and describes the services needed to assist the individual in attaining the outcomes identified in the plan. An approved ISP authorizes the provision of safe, secure, and dependable support and assistance in areas that are necessary for the individual to achieve full social inclusion, independence, and personal and economic well-being. It is important to know the individual rights so that you can ensure that rights are protected. Each person signs the rights document annually, and it is the responsibility of the support coordinator to ensure that they are aware of these rights, as well as their responsibilities to receive services under this system. The participant's statement of rights and responsibilities states that the rights and responsibilities of an individual with an intellectual or developmental disability receiving supports and services through the New Jersey Division of Developmental Disabilities include, but are not limited to, the right to exercise rights as a citizen, to be treated with dignity and respect, to be believed to have the ability to make decisions, to be free from judgment or interference, free from abuse, to have equal employment opportunities and fair payment for work, to own, rent, or lease property, to live and receive services and supports in the least restrictive environment, to express human sexuality and receive appropriate training and education, to marry and have children, the presumption of legal competency in guardianship and proceedings, to be free from unnecessary and excessive medication, to privacy during treatment and care of personal needs, to confidentiality, privacy of information and medical records, and to be free from personal and financial misuse or abuse. In addition, rights also include the ability to utilize the NJ ISP, or Individualized Service Plan, and budget to meet the needs within the waiver program guidelines, to decide how to choose services or to have someone chosen to help with decisions within the guidelines of the waiver program, to identify and invite selected participants in service plan meetings, and to a fair hearing if, for any reason, waiver services are denied, reduced, suspended, or terminated. As a support coordinator, it is your responsibility to ensure that the individuals with whom you are working are protected from abuse and neglect and that they are exercising their rights. Individuals with intellectual and developmental disabilities have the right to be free from abuse, neglect, and exploitation, and to be safe from harm. Anyone who is working with these individuals is required to report abuse, neglect, and exploitation immediately. DDD has a hotline for this purpose, whose number is 800-832-9173. This number is available to report any concerns or allegations of abuse, neglect, or exploitation of an individual with an intellectual or developmental disability. Calls may be made by any person having reasonable cause to believe that an individual has been a victim. This means you do not have to be working with that specific individual if you have a concern to report it. If you know about a situation in which the life of a person with an intellectual or developmental disability is in immediate danger due to abuse, neglect, or exploitation, you must call 911 before calling anyone else. If a DHS employee, community care residence provider, agency, or program staff person or volunteer fails to report known or suspected abuse, neglect, or exploitation, he or she can be criminally prosecuted. Not reporting cases of abuse, neglect, or exploitation of individuals with intellectual and developmental disabilities, or preventing someone else from reporting it, is a disorderly person offense. So please report anything that may be suspicious or of concern, even if you are not 100% sure. All suspected incidents of abuse, neglect, or exploitation must be reported. This includes serious events such as the death of an individual receiving services, calls to 911 in the case of a life-threatening emergency, serious injuries, restraints, rights violations, or incidents concerning the physical environment of the individual served, as well as less serious situations involving our individuals are also reportable based on DHS policies. Any type of abuse or neglect is a serious issue. Information regarding incidents and allegations is thoroughly reviewed by the DDD and DHS staff, who then works with agencies and programs to verify accuracy, to seek additional information as needed, to document and track information as needed, and to document and track the report for appropriate follow-up and response. Whenever an incident or allegation occurs in an agency or program setting, staff in these settings are responsible to ensure the immediate health and safety of the individual. This can include contacting 911, seeking medical treatment for the individual, removing the alleged perpetrator from the alleged victim, and reporting the incident to DHS or DDD. Once immediate health and safety is assured, the agency program will initiate an investigation and follow up on the incident. In response to a reported concern, DDD staff may visit the individual served in the agency or program to assess the individual's health and safety. Local police may be called to respond, or in the case of a concern involving an individual served by a program and residing in their own home, the local police and/or county-based Adult Protective Services, APS, may be contacted. OPIA is known as the Office of Program Integrity and Accountability. OPIA has direct responsibility for a variety of functions critical to helping to ensure the health, safety, and well-being of individuals receiving services. OPIA works closely with the department's divisions, including DDD and other operating units, to ensure appropriate response and follow-up when concerns arise involving individuals served or involving agencies and programs. The DHS OPIA risk management system is data-driven and is designed to meet the required quality assurances of the Federal Centers for Medicare and Medicaid Services, and includes components of the CMS quality framework. CMS uses the quality framework to measure each state's ability to meet assurances in the following areas: health, safety, and well-being, provider qualifications, fiscal integrity, and overall system performance. Quality indicators are a measurable variable created to determine how well an organization is meeting its customers' needs and other operational and financial performance expectations. These indicators are based on some of the data the OPIA units gather during the performance of their duties. OPIA issues a quarterly data report that evaluates the performance of residential and day program providers. The report is organized using national guidelines that measure key areas related to health, safety, fiscal integrity, and overall operations based on information related to agency licensing, auditing, investigations, and critical incident reporting. OPIA is able to promote best practices and provide skilled guidance that support providers in achieving desired outcomes. DHS works with agencies to address concerns raised by this review, which helps to ensure the health, safety, and well-being of the individuals served. Coming together with an individual's planning team for team meetings is where individualized plans of services and supports are reviewed. At that time, the team, including providers, guardians, family members, and the support coordinator, can discuss safeguards and interventions that may be required or necessary for that individual. By working together, guardians, authorized family members, and providers of supports and services can make sure individuals are well served and safe. This partnership begins at team meetings where individualized plans of services and supports are reviewed. At that time, the team, including the guardians and family members, can discuss safeguards or interventions that may be required. Such safeguards need to be individualized and specific to each person. Ways to educate the person and promote self-advocacy can be discussed. When unexplained injuries are discovered or seem to be happening repeatedly, guardians and family members should immediately ask what steps are being taken to protect the individual from any further injuries. Any concerns regarding the health and safety of an individual should result in the circumstances being discussed and examined. Now let's look at some potential scenarios that you might encounter as a support coordinator. Scenario 1. Brenda is a service provider at a day program and noticed when Sal came in, he had a bruise on his arm that he did not have the day before. Brenda asked one of the staff who transported the client to the program what happened, and they said that they did not know. Brenda did not know what happened and did not want to assume anything. How should Brenda go about this situation? If you answered B, call the DDD hotline, you are correct. DDD maintains a hotline to receive concerns or allegations of abuse, neglect, or exploitation of an individual with an intellectual or developmental disability. Calls may be made by any person having a reasonable cause to believe that an individual has been a victim. In scenario 2, Charles is a provider for the Happy Network who provides in-home services for individuals. Charles works with Josh twice a week and notices signs of abuse and neglect, but has yet to report it. One day as Charles was approaching the door, he looked in the window and noticed the client being physically abused by his parents and seemed like he was in immediate danger. Charles panicked and ran back to his car. What should Charles do next? The correct answer in this scenario is D, call 911. In any situation where you know or suspect the life of a person with an intellectual and developmental disability is in immediate danger due to abuse, neglect, or exploitation, you must call 911 before calling anyone else. The final scenario involves Jessica, who works at a group home with 4 individuals. 2 of the individuals were playing with a ball and one individual accidentally was hit in the face. The individual was okay, but the ball left a small mark on his face. Jessica immediately put ice on the individual's face. What should she do next? In this scenario, the correct answer is C. Immediately write up an incident report. According to the manual, you should only report situations including serious events. Other less serious situations involving individuals are also reportable based on DHS policies. In this situation, two individuals were playing and the ball accidentally hit someone, leaving a minor mark. In this case, an unusual incident report should be written to ensure the reason behind the injury is documented. This concludes our module on health, safety, and well-being of the individuals that we serve. Remember, as a support coordinator, this is one of your primary responsibilities, and it is of the utmost importance that you understand the rights and responsibilities that you have to ensure the safety of the individuals on your caseload.